How can I understand my reproductive cancer risk factors? Understanding your risk factors for reproductive cancers like testicular cancer, cervical cancer, and other related cancers is essential for making informed health decisions. It starts with learning about what increases your chances of developing these diseases and how to use that knowledge to guide screening and prevention. For cervical cancer, the main risk factor is persistent infection with high-risk types of human papillomavirus, or HPV, which is spread through sexual contact. Having HIV or a weakened immune system can also raise your risk. If you were exposed to certain drugs in utero, like diethylstilbestrol, that can be a factor too. Women who start having sex early, have multiple sexual partners, or smoke are at higher risk. Regular screening with Pap tests and HPV testing is vital for early detection. Starting these screenings at age 21 or 25, depending on your local guidelines, helps catch precancerous changes before they develop into cancer. Women with higher risk factors might need more frequent or specialized screening, so staying in touch with your healthcare provider is important. Testicular cancer usually affects younger men, especially those between 15 and 35 years old. Key risk factors include having an undescended testicle, known as cryptorchidism, a family history of testicular cancer, or having had testicular cancer before. Certain genetic conditions can also play a role. While there is no routine screening for testicular cancer, performing regular self-examinations can help you notice any unusual lumps or changes early. If you find something suspicious, seeing a healthcare professional promptly is crucial for diagnosis and treatment. Other reproductive cancers, such as ovarian or uterine cancers, have their own risk factors. Age is a significant factor, with risk increasing as women get older. A family history of related cancers, especially breast, ovarian, or colon cancer, can indicate inherited genetic mutations like BRCA1 or BRCA2 or Lynch syndrome, which increase your risk. Hormonal factors, obesity, and reproductive history also matter. For example, women who have never been pregnant may face a slightly higher risk. Screening recommendations vary depending on your personal risk profile, but in some cases, tests like transvaginal ultrasound or endometrial biopsy are used for high-risk women. Knowing your family medical history is a key step. If relatives have had cancers linked to inherited mutations, discussing this with a healthcare provider or genetic counselor can help determine if genetic testing is appropriate. This can give you a clearer picture of your personal risk and guide tailored screening plans. Modifiable lifestyle factors also influence your risk. Avoiding tobacco, practicing safe sex to prevent HPV infection, and getting vaccinated against HPV are effective ways to lower your chances of developing cervical cancer. Maintaining a healthy weight and managing hormonal factors can help reduce risks for other reproductive cancers. Always remember that individual risk varies widely, so consulting healthcare professionals for personalized advice is essential. They can evaluate your personal and family history, recommend appropriate screening schedules, and discuss preventive strategies suited to your specific situation. Understanding your risk factors empowers you to take proactive steps toward your health and well-being.